Hello, I'm Dr. Maria Solindro, specializing in integrative anti-aging medicine, practicing in Pasadena, California. Welcome to my streaming video today, and I'm going to discuss about if you have insomnia or what is insomnia and how to manage insomnia if we have without drugs, hopefully. And this is what we are going to, I'm going to talk about, okay? Well, what is insomnia? It is not a symptoms, we know that, and it is a disorder, or you can say it's a problem, and we have to find out why you have a disorder of sleep, and we call it insomnia. It is a very common disorder. Basically, you have hard time falling asleep, hard time to stay asleep, and waking up too early, and not able to get back to sleep after you wake up in the middle of the night. Now, usually, patient will still feel tired when they wake up in the morning, and they cannot get enough sleep, which is normally 7 to 8 hours in one night. That's what normally people would like to achieve. And these sleep numbers, though, it's very personalized. Some people only sleep 5 hours and feels refreshed the next day, but when they get older, they feel they need to sleep longer, and often they cannot do it and complain about insomnia. At some point, many adults experience short-term or acute insomnia, which lasts for days or weeks, and it's usually the result of stress or traumatic event. But some people have a long-term or chronic insomnia, and that lasts for months or more. Insomnia may be the primary problem, but or it may be associated with other medical conditions or medications. You don't have to put up with sleepless night actually. Simple changes in your life, your daily habits or lifestyle can often help. What is insomnia symptoms? Well, when you have difficulty falling asleep at night, that's symptoms of insomnia. Waking up during the night, waking up too early in the morning, feeling tired after waking up, irritable, depressed, and some patients have anxiety about going to sleep because they won't be able to fall asleep, and sleeping during the day is often happened, and patients cannot focus and they feel sleepy. There are 4 stages of sleeps. Sleep cycle is awake in the bed, and then you go to sleep stage 1, and then you go into REM when the sleep is on and off before you go to stage 2. Then you go to delta, which is the deep sleep. What can be the cause of insomnia? There are many of them, and let's name one by one, okay? Insufficient or imbalanced nutrition or nutrient can cause muscle to tense, and this making it difficult to go to sleep because you have a tense muscle, neck, and back, so you have pain sometimes. Or psychological reason, excessive stress more than usual, and work performance not good, so you keep thinking about it, or some students that fail in their school, or this kind of stress. It can be chronic. The chronic stress is thinking about life events like death, divorce, Sometimes even the happy occasion, such as wedding, can create an unrelenting stress and insomnia. Because many people plan about wedding, as some of them plan it 2 years before the wedding date. So that can be 2 years, cannot sleep at night thinking about what I have to wear, what I have to do, who I'm going to invite, things like that. Hormonal, it can be chronic because hormone imbalance, people are not aware that they are imbalanced in hormone and they don't go see their doctor or test the blood, or if they see the doctor, not everyone has hormones, right? This can be checked like cortisol, thyroid, serotonin, or low progesterone when it's imbalanced. Or when melatonin hormone is low, this can really be disrupting in terms of going to sleep. When the eyes are less sensitive to darkness, and it makes the brain cannot shut off and it keep working or keep thinking, because melatonin is actually for a better memory. Melatonin influence also a biorhythm in our body, or what is called body clock. Long distance traveling across many zones and losing some hours differences, the body have difficulty to adjust back, and this is called jet lag, and this can cause insomnia. Work shift changes, people who uh, they have a disruption of their biorhythm or body clock, and this can cause insomnia. Poor sleep hygiene, such as watching television before you go to bed, working on computer, video games, smartphones, or other screen that has a blue light will interfere with your melatonin production or preparation of your brain to go sleep with the calm situations. That is called blue light, all of those. And those are from the cell phone, TV, UV light. Those must be off 2 hours before sleep. So that's the sleep hygiene. The blue light when you wake up at night and you go to the bathroom, all those night lights you think is small, but it can cut the melatonin production and interrupt the sleep cycle. How about eating too late in the evening? Yes, after 6 p.m., you should just stop eating or drinking water. If you want to drink water, a lot of water, just drink it in the morning, afternoon, and just stop before like 7 o'clock, because if not, it would when you're still making the urine in the bladder, then you can actually the bladder can wake you up at night. If you sleep right away after eating meals, that will also cause problem in metabolism and hormones, or also often cause acid reflux, which cause insomnia, because the acid reflux is very irritating in the throat, and you can wake up because of acid reflux. And this sometimes cause back pain, which develop many in people who sleep or who eat at night before sleep. That is basically sleep with full stomach. People with anxiety, stress, and depressions can oversleep or undersleep as well, and eventually cause insomnia when the symptoms is worsened. Stimulant such as coffee or tea that has caffeine, or even drugs that alter the effects and mood and can cause insomnia. People sometimes drink alcohol at night, which they think it does help them to calm and sleep, but then it prevents a deep sleep. so they will just wake up earlier. Other medical problems that link to insomnia, such as cancer, diabetes, asthma, gastrointestinal reflux, high blood pressure, hyperthyroidism, Parkinson's, Alzheimer's, and sleep apnea. Okay, so when you sleep and then stop temporarily, that will wake you up and you have difficulties going back to sleep again. Hypomagnesia, lack of magnesium, always cause problem with muscle twitching and spasm or irregular heartbeats that can also cause insomnia. How about insomnia and aging? Well, insomnia becomes more common with age. As you get older, you may experience it, which is change in a sleep pattern. Sleep becomes less restful as you age. Noise and other changes in your environment more likely to wake you up. With age, your internal body clock often also advances. So you get tired earlier in the evening and wake up early in the morning. But older people generally still need the same amount of sleep as the younger people do. Changes in activity, such as you may be less physically active or socially active, lack of activities can interfere with good night's sleep as well. So the less active you are, the more likely you may be to take a daily nap, which can interfere with sleep at night. Changes in health, chronic pain from conditions such as arthritis, rheumatoid arthritis, gouty arthritis, or back problem, even depressions or anxiety, they all interfere with sleep. That's a medical problem cause insomnia. Issues that increase, like increase in urination because of prostate hypertrophy or bladder problems, can disrupt sleep. We talk about sleep apnea. How about restless leg syndrome? So people complain why their legs are jumpy. So this is due to a minerals imbalance, such as salt or sodium and magnesium. More medication. The older they get, patients get medical problem, and then traditional doctors put them on medication. So when you use more prescription drugs, increases the chance of insomnia associated with medications. How about children and teenagers? Well, the children's sleep pattern changes. During when they were babies, every 3 hours they wakes up and they wake up and then they want us to feed them. And then when they're older, they still need napping in the afternoon, but then will wake up also early in the morning. After high school, they sleep late and they wakes up early because they have to go to school. Even in college, because they somehow, these teenagers or in the 20s, they need to sleep late, like midnight or even after midnight. However, sleep problem may be a concern for children and teenagers. However, some children and teens simply have trouble getting to sleep or resist a regular bedtime because their internal clocks are more delayed. They want to go to bed later and sleep later. And sometimes in the morning, they fall asleep. Risk factor of insomnia. Nearly everyone has an occasional sleepless nights, but your risk of insomnia is greater. So you can have sleepless night. But if you're a woman, your hormonal shift during the menstrual cycle and in the menopause period may play a role. During menopause, night sweats and hot flushes often disrupt sleep. They wake up because they feel hot and sweaty and wet. They have to change, and then after that they want to go back to sleep and they have difficulties going back to sleep. Insomnia is also common in pregnancy. If you're over 60, because of changes in the sleep patterns and health, insomnia increases with age. If you have mental disorder or physical health condition, this is also an issue. Many of these issues will will disrupt the sleep pattern. If you're under a lot of stressful time and events can temporarily cause insomnia. And major long-lasting stress can lead to chronic insomnia. If you don't have a regular schedule, for example, changing shift at work or traveling can really disrupt your sleep cycle. What about the complication? Is there a complication of insomnia? Well, the insomnia impact the quality of life. If you have problems sleeping, definitely you don't feel happy. Usually people who has trouble with a good night's sleep usually people who has a good night's sleep feels happier and content. Insomnia affecting the performance on the job or at schoolwork. So that's complication. And having difficulties also concentrating at work or at school. Affects mental health disorders such as like depression and anxiety disorder, that happen with insomnia. Some people end up taking medications, and these drugs cause substance abuse because they want to sleep, so they just need that medication. And if no medication, they feel anxious, and they need to get the medication. So they're dependent on this sleeping medication, or what we call sleeping drugs. Okay, increased risk of health condition and medical diseases such as high blood pressure and heart disease. This also can affect brain function. Non-prescription management is what you want to learn. If you don't have the insomnia yet, at least you heard about it if you learn it, all right? And then when you think you have insomnia, quickly find the cause of the insomnia and exercise this non-prescription management, which include preventive measures. For insomnia, any prescription drugs such as Ambien, Lunesta, or even sedative like benzodiazepine, Lexapro, they all have studies, but it doesn't cure insomnia. You just get hooked to the medication later on. Since insomnia is a disorder and it is not just the symptoms, we have to find the cause and treat the cause of insomnia. For prevention, the best preventive measures is CBTI, Cognitive Behavioral Therapy for Insomnia. You have to psych yourself, meaning that you have to think what to do when you plan to sleep. This cognitive behavior is positive attitude towards sleep. Good sleep hours, nighttime sleep habit. People wake up too early or very late. The best is make sure you want to wake up at 6 or 7 in the morning. And due to insomnia, wake up early is very uncomfortable because you cannot sleep on time and you need that sleep, and yet you have to wake up. But this is that's why it's called cognitive behavioral therapy, because when you wake up that morning, then you feel very tired by the time 8, 9, 10 o'clock comes, and then it will give you a chance to fall asleep better. So waking up at the same time with maybe clock alarm, alarm clock, that will help you. Or then to stay active. Regular activity every day helps promote good night sleeps. You have to stay active. You have to stop any medications to see if they may contribute to insomnia. Those are like a high dose melatonin or energy formula. Let me explain a little bit about melatonin, because I encourage my patient to take high dose melatonin in the morning. That's because melatonin is not a sleeping pill. Melatonin, it helps your eyes to be more sensitive to darkness, and also helps your body bio-clock or biorhythm. Number 2, it helps your cognitive function or memory. So if you have to take high dose at night, then if it works for your brain, then you have to keep thinking about many stuff, then you cannot sleep, right? Yeah. So do not naps in the afternoon. Try not to sleep during afternoon at all. Stop caffeine and alcohol, and do not use nicotine. Don't smoke. It will make your sleep shallow. And then you wake up too early in the morning, like 1 o'clock, 2 o'clock, then you cannot go back to sleep. No meals or beverages before bedtime. At least you have to allow the MMC, migrating myoelectric complex, about 3.5 hours. No eating, no drinking period, or at least 3.5 hours, and it can be 5 hours. That way, your body concentrate with your brain to put you to sleep instead of your stomach. Make your bedroom comfortable for sleep. Make up the bed in the morning, so when you plan to sleep, your bed looks tidy and inviting. And so bedroom is not for play or, playing card or game mahjong. The bedroom, no. Those are done outside. Bedroom is only for sleep, or if you're married, for sex, it's okay. No watching TV. Don't play games there. Okay? Create a relaxing bedtime ritual, such as taking a warm bath, warm shower, and you can read, but using warm light, the yellow light. Listening to soft music is okay, not rock and roll. Okay, so this is called sleep hygiene. No TV, no cell phone, no smoking. You can do exercise or jogging like 1 hour before you sleep, so you get so tired. That's promote tiredness, then you sleep better. No caffeine, no alcohol. You can exercise calming technique, how to stay calm, meditate, pray. Make sure the right temperature in your bedroom. Cool. The best is around 60 to 68 degrees Fahrenheit or 15 to 20 degrees centigrade. Use proper bedding, the one you like. Don't use dimmer. No dimmer. Then empty the bladder before you go to bed, sleep. According to Stanford study, 2 weeks of insomnia will lead to depression. So insomnia is a risk factor to develop depression. Treatment with benzodiazepine or receptor antagonist like Ambien, Lunesta, all of these help temporarily. And it can lead to addiction, like I just mentioned, and drug dependency. In the Stanford study, they also use sedative, that is low dose of trazodone. And apparently that effect is much better, but still is not the solution. Conclusion of the study in Stanford, cognitive behavioral therapy insomnia for insomnia or CBTI is the best. Dr. Posner, Posner from Stanford stated that melatonin is not sedative or hypnotic, but it is chronobiotic. So it improves the body biorhythm, improving the circadian. So it improves the sensitivity of the eyes to darkness. When we are older and reach menopause or andropause, we are not too sensitive to the darkness because our melatonin is less and less. It's 15% less every decade since age 20. The other function of melatonin is actually improving memory. So this is where we have to be careful. So at night, when you have good enough melatonin, you have a tendency to think and your brain is not unwinding, but your brain is whining all the time, thinking all the time, right? Melatonin comes in a different size and also different quality and different and delivery system if you take it as a supplemental. They come in time release where it releases slowly and it keeps you and helps you to sleep through the night. And use small dose. I use 3 milligram time release, and it takes about I take it about 6 or 7 o'clock in the evening, not too late. So when you reach bedtime, which is around 10 o'clock, turn off the light, completely dark. It will then initiate your biorhythm, and you feel sleepy as the room is dark. In my office, I also composed what we call easy sleep. I call it E and then Z sleep. And inside there is a L-theanine, which is a derivative of green tea that helps to relax our body. Taurine boosts GABA and reduces anxiety. Melatonin, small dosage, 3 milligram. GABA, reduce anxiety. I use 100 milligram. 5-HTP, hydroxytryptophan. That one it's participate in the body of synthesis on serotonin, which just calming the brain, happy hormone. Another thing I use actually is homeopathics. The reason why I use homeopathics and it's called quietude is because you don't need water. So just put in your tongue and then it melts. And you can repeat that every 15 minutes if you don't fall asleep. And this has huperzine, which is plant extract, and it improves the sleep REM, the stage of dreaming in the sleep. And then it also has hyoscyamus, hyoscyamus niger. That's work as a hypnotic and pain relief. Nux mochata, that is also a great make you feel sleepy, and especially it also affect the nervous system, so make you calm. And then passion flower with Passiflora icama cause sleepiness and drowsiness. This is sedative. Stramonium is also reduction in anxiety. So far, okay, easy sleep, quietude, and then I use Sedahlia. This one has something to reduce anxiety and stress. It has several things in there also. Aconitum, belladonna, calendula, fibronum, opulus. Okay. All right. So take home message here. Do not stay in bed if you cannot sleep more than 30 minutes. Just get up and do something like the one we discussed. Exercise, reading, praying, take a warm bath, drink a warm milk, or anything like that. But be careful when you start taking fluid, and then you will wake up. The bladder will wake you up. Number 2, get up and do something, right? So this one you have to practice day after day until you get it routine. Some people read the same book for 30 years, same book, and then they fall asleep. And then the next day, the same book, they read again until they fall asleep. they cannot finish the book, I guess. So avoid blue light, remember that. And take some Sedahlia, quietude, easy sleep, melatonin, right? They all are GRAS, generally recognized as safe, GRAS. All of these are regulated by FDA, but not necessarily approved because they do not have side effects. Only drugs needs to be approved by FDA. Always try to wake up at the same time, 6 or 7 o'clock in the morning, and try to take your blood test and nutritional evaluation if everything failed. Go see your doctor because your hormone might not be balanced. And then the doctor might give you a little bit of temporary medication. If you really have to sleep that week, then the result comes, then we can discuss about it. Don't get frustrated. Okay, review the bed hygiene. Okay, and then so these people shouldn't be left with no ability to sleep. They should be able to sleep. Do not keep insomnia, as this is a risk factor for heart disease, high blood pressure, and depressions. Okay. All right. Let me see. I'm not quite sure how to check questions, but because my phone doesn't work for some reason, but if you have questions, please put down in a comment, okay? And I would like to tell you that today is my last live streaming in 2020, and I will see you again in 2021. And I hope 2021 will be the opposite of 2020 in terms of this pandemic problems, and we all will be healthier and happier. Now, if you like the program, still don't stop telling people about my subscription on the YouTube. It's a free subscription, and it's every Thursday at 5 o'clock. And then Give me like when you go to when you listen, and if you like it, and make sure you share with your friends, and don't forget the bell notification. Okay, I would like to wish you all happy holiday. If you celebrate Christmas, Merry Christmas, and also when New Year come, Happy New Year. Be happy and make sure you can sleep good. Thank you for watching. I'm Dr. Maria Solindro, Integrative Anti-Aging Specialist, practicing in Pasadena, California. Thank you, and see you soon.